Hello, hello. Happy New Year, everyone. Good evening, good evening, good evening. Um, make sure everybody's quiet. Yes, I just want to make sure. Yes, yes, yes. Good evening, my friends. Happy New Year 2026. I am so excited to see you guys back. And this is our very first live since 2026. Believe it or not, our very first live for since 2025 for 2026. And I wish you all the best this new year. May it bring you peace, joy, may all your dreams come true. And now, without any further ado, let's have a word of prayer. And just want to double check, sure that I'm really live. And then we will pray and get on our way. So hold on a second. Okay, so like I am live. Perfect. Okay, let's have a word of prayer. Father God, thank you for another day, another year, 26. Thank you for the opportunity to be on this live as we're going to share with your children some of the updates that are coming up on the Nclex and also share with them some strategies, test questions. For many of our students, it's a lot of challenges and they are studying hard. They are looking for the right resources to be able to be effective. May you bless their journey. Be with them, give them intelligence from above, give them Holy Spirit wisdom so they can be ready and be successful on the day of their exams. Give our sins in Jesus' name we pray. Amen. All right, guys, welcome, welcome, welcome. And let's go ahead and get started. I'm going to share my screen. I'm going to share my screen. So you guys will be ready. Let's go. It's going to be, uh, let's see, because I have, there you go. That's the one I want to share with you guys first. Okay. All right. And if you're on this live for the first time, do not hesitate to share with your friend. And also, if you have not subscribed, please do so. Um, and comment a like. And if you have any questions, please, you can put in the chat and we'll be able to answer you. Okay, so this is some of the updates that coming up on Nclex April 2026. And a lot of people are wondering what's going on, how do I get ready? And of course, the better you are prepared and the better you'll be able to be successful in the exam. So that's the reason we want to bring the updates to your attention so you could be ready and steady and be prepared because this test is already stressful. You don't want to be more stressful. And that's why we ask you guys to know the do's and don'ts. Be prepared, what to be ready for, the strategies, techniques, the blueprint. Remember, I did present to you this book that we put together. It's all the blueprint and clicks. And we had another one with all the NGN. But just so you know, we need to know some of the changes that's coming up the next few months, starting April. And if you have not taken your exams, well, I know a lot of people they're trying to get it out of the way so they don't have to face the new exam coming up this April. And if you are waiting until April, these are the changes that you need to expect to see. And that's what here on this live afternoon to share with you. And so it will be effective April 1st, 2026. We wanted to know it's not going to be mid-April. The changes will not be effective toward the end, but the first day of April. And it will not be April Fool either. Okay. So this highlights what is changing and what is staying the same in the 2026 NCLEX RN test plan. The core exam framework will remain intact, okay, just so you know. The updates mainly will reflect the modern nursing practice and language. So 2026 NCLEX test plan, what changed versus what stayed the same? And that's what we here this afternoon to share with you. If you have also friends on TikTok, you might as well share them. Okay, I think I will also do that sometimes, but I was trying to get on TikTok and I was not able to log on effectively, but I will also share. But you can do that for me. So key changes. There's gonna be quite a bit of changes. I have a total, let me see, about 7 changes right here. And things that will be the same, we'll also share them with you. So about 7 key changes and things that will be the same. It's a total of 5. So let's go over them one by one. First of all, what will not be changed? Just so you know, the NGN, which is the new generation NCLEX, the format will remain the same. Case studies. Remember, in the case studies, we had a total 7 style types of questions, like case studies. Remember, each case study, you could get a total 6 questions. The 3 case studies, total 18 questions. In the style, we usually find both high, the matrix questions, and what is it, the drag and drop, the filling in the blanks. But these NGN format will remain the same. And some of the things that will not be changed is the 8 client needs categories and the percentage weight remain unchanged. So just so you know, 8 client needs categories and their percentage weight will remain the same. How about passing standard level? Remember, for RN, usually you can the computer will shut down maybe by about 75 or 80, or that could be whether you're really whether you're really good, or you can go all the way till the end. So just so you know, that format, the passing standard will not be changed. I believe it's 150 total questions. So you know, it will be the same amount of questions. Okay. Now, ongoing focus on clinical judgment and entry level safe practice will be the same. So remember the 4 level style of questions. The first one is knowledge, or the testing your knowledge, like your vital signs or your lab results. And the second type is your understanding, right? The third one is for uh, application, and then the last one, analysis. So these are the more critical. So these levels, they will not be changed. They will remain the same. And ongoing, okay, so that's what we have, ongoing focus on clinical judgment and entry level safe practice. And remember, NCLEX, how they test you. So they want to make sure you can you're strong on the basic questions like basic care and comfort, how to prepare the body after death, what you need to do, how many tags you're supposed to have. Let's say that the body is going for autopsy. Should you remove the tubes, any lines? How do you communicate therapeutic changes? How do you do your vital signs? So those basic care, comfort, they will be the same. Assistive devices. So just so you know. Now, the last thing that will not be changed is the core content areas. That will be the same. And we know when we come to NCLEX, they usually test through their med surg level, right? And remember, that's your care, managed care, over 20%, right? So these will not be changed. Your pharmacology, they're still going to be tested on pharmacology. You're still going to be tested on med surg. You're still going to be tested on psych. You're still going to be tested on maternity level, as well as pediatrics, etc. So these core content area, they will not be changed. So far we have a total um, 5 core changes, and they will remain the same. Okay. Now, what about your what about your uh, things that will be changed, things that you need to expect? So, for instance, hold on a second. Just want to make sure we have test plans activate. Okay, so the first change you will see test plans. A test plan activates, we said it's going to start April 1st, 2026. Previous plan ends, we said, in March 31st, 2026. Okay, so it will be activated the 1st of April. So the first thing that's going to be changed is your safety and infection control. And they will basically, how's that going to be changed? It's just the name, the title is going to be changed. The content, not so much content, but the title. It says here, safety and infection control will be renamed to safety and infection prevention and control, because the goal is really to prevent someone getting um, infection, okay, or also how to protect your patient from getting infection as well as yourself. So the goal is going to be more focused on prevention. So that's the change for safety and infection control. What about the second thing? We said added explicit emphasis on health equity and unbiased care across demographic. So that's gonna be a new change, and I'm gonna give you guys an example on that. That's gonna focus on health equity and care across demographics of different parts of demographics. And a third thing that's going to be changed is clarified monitoring for advanced internal devices. Example, intracranial monitors. So just so you know, you will that will be clarified. Clarified monitoring for advanced internal devices. Let's say someone has an internal device, so that they will clarify them. That's it's gonna be more detailed, so you're gonna have more questions about that. Now, next thing, updated guidance on privacy, social media, and confidentiality. As you all know, these days we all use social media to some degree. And remember, HIPAA rules, HIPAA laws never change. So they want to now update some of these guidance on keeping patients' privacy, especially through social media. So you're gonna be more aware. What do I need to do on social media? What should I not do? What can I basically the HIPAA laws. Now, the next thing that's gonna be changed is time advised shift from 1 to 2 minutes per item to reasonable pace. So basically, the time will be shift from 1 to 2 minutes per question, okay, and reasonable space, okay. So just so you know, that's gonna be changed. And next thing I have here is modernized terms. Modernized terms such as substance abuse to substance misuse. So it used to be substance abuse, now it's going to be changed to substance misuse. So it's just different terminology, but the content will be the same. I just want you to be aware of these things. Okay, the content will remain the same. Okay, very important. And now we have some quick teaching notes. Okay, what to tell students. Expect familiar questions types on client needs, structure. Focus on preparation, on safety entry level, like basic care comfort practice and strong clinical judgment. Remember, Nclex, they want to test your understanding rather than your knowledge or your things that you memorize. It's not about memory. It's about case study because you're going to be exposed to live situation, live case scenario. So they want you aware. So since that's what you're going to be exposed to one from a nurse, so they want you to be prepared. Okay, use a lot of critical thinking and judgment. So that you need to know. And next thing is health equity and unbiased care. That's one of the things that I had, one of the top things here. What does that mean? That's practice culture responsive communication. Okay, that's what it is. How to avoid assumptions. Like, don't treat everybody the same. Like, don't think all black people, they think alike, they do things the same way, they have the same routine. No, I may be black, but I don't have the same values, the same opinions. So basically, do not stigmatize people or all Indians eat hot food. No. So you just need to remember, all Muslim, they all are religious, things like that. You need to be culturally sensitive. Excuse me? Okay, yes, or they all are curious. Okay, somebody just remind me. So do not stigmatize people, and that's when culturally competency comes into place. Because as nurses, we're supposed to be culturally competent, and a lot of times we forget that. Okay, a lot of times, like Jewish people, we have different types of Jewish people. We have the Orthodox Jewish, you have liberal, and you have very conservative. So I already mentioned three types. So when you see a Jewish, I don't just think, oh, they all are religious or nobody, none of them smoke. No, it's not always so. So as nurses, we need to be not just professional, but we need to be culturally ready and culturally competent. And that's what the new Nclex change in April, starting 1st of April 2026. They want you to be culturally competent. Does that make sense, guys? Okay. Um, so practice culturally responsive communication, avoid assumptions, and tailor teaching plans while maintaining standards. Of course, remember all these things, safety is always about a mind. Okay, we're not going to negotiate patient safety for their culture, their culture, their cultures. As long they are safe, practicing, and you can teach them what to do. Let's say an Indian person comes at the hospital while you're caring for their mom. The daughter wants to be involved in their care. That's part of the culture. And you can't say, oh, I'm so sorry, I cannot let you be part of your mom's care, or you can do this, you can do that. No, you should and welcome that. And especially that's part of their culture. So again, we got to be culturally sensitive. The next thing that we want you to bring to your attention that's going to be changed in Nclex starting April 2026, guys, is privacy and social media. Like we said earlier, we mentioned it a bit. So it reinforces professional boundaries like confidentiality principles and safe documentation and communication behaviors. Because I cannot even name how many platforms we have. We have Twitch, we have TikTok, we have Facebook, we have YouTube, we have what is it? The what is it? X. And then there's another one. What is it? Snapchat. There's so many. And as they want you to make sure you have to be mindful. What are your rights? Also, what are the patient's rights? How do you keep those patients' privacy while you're on those platforms? So that's the new NCLEX starting April 1st, 2026. And next thing here to note for April 2026, starting the 1st April, yes, it's not April Fool, guys, as I said, it's the device monitoring language that I mentioned earlier. Now I'm breaking all these things down to you. So what does that mean? They want you to review priority assessment and responses when monitoring data changes, such as neurological status, okay? Especially if somebody's going for MRI. Okay. Um, or going for MRI, but then they have, let's say, a device, an internal device. You need to call a tech. Are these devices are MRI compatible? Or what are the priority assessment and responses when monitoring data changes? Okay, is patient alert oriented? Are they understanding what the test or what they're going to do? So, device monitoring language, will they be able to understand those procedures? So, all these things, okay, this is another thing that we need to be mindful of. And then pacing. Pacing is to encourage steady progress and accuracy. Use time practice sets to find a sustainable and reasonable pace. So sometimes patients they feel like they're being rushed into things where doctors making decisions for them. And even as nurses, we forget we are patient advocates. We just tag along with the doc and forcing patients to do things that they don't even understand. They don't even they don't want to do sometimes because they lack of understanding and they give them time to make decisions. So forcing them to make quick decisions. So it says here to encourage steady progress and accuracy. Use time practice sets to find sustainable, reasonable time. And who's going to coordinate that, guys? We nurses, RN. Because remember, in the circle of interdisciplinary team, we are inside that circle with patients. And outside, it's all the interdisciplinary team members. We're talking about the nephrologists, the cardiologists, the pulmonologists, along with the therapists, right? The rehab team, and the family members and the tech. So that's what in the middle of the box we need to be focused on our patients, their safety, their dignity, their their rights. So know what's right for them so we can help them along that journey because being sick, you are vulnerable. And sometimes they feel like they're by themselves and nobody is there for them. Nobody can speak on their behalf. And you know, guys, as nurses, we meet patients. Some of them don't even have families. We become the patient's family. So we are the patient's advocate. So remember, it's very important that we need to support patients from A to Z when they come from day of admission until the time they leave our premise or facility. We need to support them all the way, guys. So students, study, focus, checklist that. Now, what are you going to be remembering? What is the focus? Let's say you are ready to go for the exam on April 1st. And sometimes, just so you know, even before April 1st comes, sometimes, there's usually 10 or 20 questions where they actually try, even though these don't count part of your passing grade, but they're just testing because these are future questions. So you might see those even before April 1st. So these are some checklists. Questions you need to remember. Infection prevention. Remember, we said it's no longer infection control, but it's infection prevention because the focus is more prevention. PPE, the donning, the doffing, your airborne. What are the PPEs for your airborne? You got to wear everything. The gown, the mask, the gloves, the eye shield, the donning, the doffing, the droplet. What are the PPEs? Your mask and your gown and your gloves. What about your contact? Remember your gown and your mask. And then neutropenic precautions. Remember, these people, they are very vulnerable. Either they are battling with cancer and their WBC is what? Less than 5,000 or 2 or even 1,000. You need to know what are some of those neutropenic precautions. Let me see if you guys remember. What are some neutropenic precautions, guys? No live plants, no live flowers, no raw meat, limit the visitors in the room. These are basic care comfort. They're all under infection prevention, right? And should these patients were to leave their room, they need to do what, guys? They need to wear a mask, but they're not gonna wear N95, It's just regular mask because even ourselves, when we enter the room, we wear normal masks unless it's an airborne room. The airborne room have to wear white guys. We have to wear the N95. But our patient, should they have to get out and go for a procedure or any type of procedures, they have to wear just normal surgical mask or normal mask, but they don't need to wear the N95. We have to wear N95 when we are entering an airborne room because the goal is to protect you, not your patient, but yourself, right? Because they're already infected, they have TB. Remember, TB is a disease of the lungs, an infection, because their lungs look like cheese coated with pus. So when you are wearing the N95 is to protect you. But when you are entering someone who's on neutropenic precautions, guys, you are protecting them. The focus is them. You don't want their WBC to be more depleted because they're already fighting for their lives. Infection, the soldiers, because that's their immunity, which is their protection. And down, or have AIDS, whatever. So we need to know what to do. So infection prevention, guys, you know, ever since COVID hit, infection prevention is no longer the same. Now these days, everybody wear masks. Okay, make sure you wear gloves. I wear gloves in every procedure that I perform. Okay, always sanitize and wear your gloves. Now, when do you wash your hands? Let's say you have to go to you entering someone who has C. diff, MRSA. Are you going just to wear and sanitize and wear your gloves? No, you have to wash your hands before and after, guys, because it's contact precautions. Do you see the difference? So remember, every 3 patients, unless your hands are visibly soiled, or you are performing, let's say, a Foley catheter, or you are entering a C. diff patient, you have to wash your hands. But usually we hand sanitize before we enter every patient room, before and after. And we wash our hands when our hands are visibly soiled, right? When every 3rd patient, or let's say you have 3 C. diff patients, before you enter each of their room and leave their room, you have to wash your hands. You guys see the difference? For wound care. So you need to remember all these safety issues, which is infection prevention, PPEs, donning and doffing. Remember, CDC has one, the CDCs, and these are basic care comfort, easy questions you cannot afford to miss on Nclex exam. Sterile versus clean, like I just told you. Foley catheters or what? Sterile procedure from A to Z. What do I do first? First, I'm going to prepare my patient, right? And what? Of course, you could use clean gloves, right? Position your patient. Then, if you have to perform any pericare, that's still clean technique. Then you hand sanitize your hand, and then you open your sterile kit now, hand sanitize. Now you're going to do what? Place that drape. You don't need to, usually it's before the sterile glove. So you pick up that drape and place it under the patient's button. And now this is when you're going to do it. After you open that sterile package, and now you're going to do what? You're going to don your gloves, your sterile gloves. And everything in that package is sterile, right? And then you proceed. Okay, so we're talking about infection prevention, PPEs, isolation, sterile versus clean technique, and reducing HAIs, which is hospital-acquired infections. We put them on our patients. They did not bring them. They did not come with them. So we need to be mindful, and sometimes these will prevent a lot of lawsuits, and you may even be fired, especially if you keep putting those HAIs, and they know you are one of the causes. So be mindful of those things. Now, students, study focus list. What are you going to focus while you're studying, while you're getting ready for your first April 2026, guys? The second thing you need to be mindful of is equity and unbiased care, which is communication. How are you going to communicate to your patient therapeutically? How are you going to interpret? How you going to use the machine for interpreting? These days, we see, like I go to the hospital and I see a lot of those machines, and HCA have them, those greens. Of course, it says interpreter. So they don't hire like a really a live interpreter, but they have these interpreting machines. Whatever language the patient use, even sometimes they don't speak at all, they don't speak, they don't hear, but they can use those machines. So just so you know, how do you use them? How do you set them up for your patient? So equity and unbiased care. What else is under that type? Interpreter use, we said communication, respectful assessment, avoiding assumptions. Do not stigmatize people, like we said. Don't put all people in one basket. They are all the same. Again, culturally competent. Remember, each person will have a separate charge. Not only that, they'll have a separate care plan because each person's health is individualized. So remember that, guys. Next thing, student study focus checklists, guys. The third thing I have here is professionalism and confidentiality. Again, when you go into the social media, be careful. How to be professional. I've always said they pay people to smile on your face. If you have personal issues, stay home. Don't go to work. Don't go to work because you're gonna have a bad day. And you cannot project your problems, your negative feelings on your patients. They will actually not even trust you and say, okay, I need another nurse. I'm so sorry. Or could you please let me see the charge nurse? And you will be sent home. So just so you know, professionalism, confidentiality, HIPAA basics, social media boundaries. So all these things, these are under the new checklist for April 1st, 2026. And I'm excited about that because all these new things, they are really to help the patients here and help you to be a better nurse. And also, just so you know, I know it might seem like, okay, so will I have a chance of failing? No, I think these will also may help you to even passing, if anything, because these are the things that you are living now. Okay, these are life experience. Social media, documentation safety. The next thing I have on the list, student study focus checklist, guys, is priority monitoring. How do you prioritize your patient? Which one you need to see first? Which one you're going to delegate to your LPN? To, let's say you're working on a mixed floor. Which patient, let's say you have a nurse from OB, from P, who come to see your patient. Which patient they need to see first? Which patient which patient that can help, that they can help you with. Okay, I'm going to have another lab. I don't know when. I do really want to help with that priority and delegation. So I will let you guys go when, excuse me, I could come with another life to focus on that more because that can be a bit challenging for some people. So priority monitoring, trends in vitals, newer check. Okay, do you see a trend like patients been spiking since this morning, but you're not paying attention? Patient blood pressure has been dropping, but yet you go and give that blood pressure medication. Even though doctors don't give you a parameters, all you have to do, just check that blood pressure. And you need to think, oh, okay, I need to call the doctor, get a parameters. But even when you get the parameters, guys, you need to critically think. Like I myself, in my real practice, like let me tell you, my systolic is 120, honey, you are not gonna get a blood pressure pill from me because I know that blood pressure gonna drop lower. And just to prevent any problem or rapid response, I will not give you that blood pressure pill. So you need to know when not to give it, even though you have parameters, right? So safety. So again, priority monitoring. How you prioritize, how safe are you on the floor? And that's what Nclex is going to test you, the new update 2026, starting April 1st. So trends in vitals, newer checks, device monitoring, concepts such as ICP signals. Okay, who can tell me? Go ahead, put it in the chat when your ICP is increased, right? Increased intracranial pressure. What other signs? Definitely you want to think up here. They're gonna have headache. The blood pressure gonna be elevated, right? And what else? Essentially, that could lead to what? Seizure, guys. How is the heart? Yes, the heart is also racing, right? And the respiratory rate is also racing. They don't necessarily have to have an infection, right? But these are the signs of intracranial pressure. And usually, if somebody has intracranial pressure, remember, can they be tested like check for their lumbar LP, which is lumbar puncture? No, because if they were to be tested or having a lumbar puncture, the ICP will be increased even more because of the liquids secreting from their spinal cord. That will make cause their ICP to be more elevated. So no LP or lumbar puncture for someone who has intracranial pressure already elevated. So also, what do you want to make sure in the room? You need to limit the amount of what is it, lights, all these what do you call this, stimuli, the noise in the room, the light, the beeps, all these sounds, these will increase their ICP. You want calming environment, and I know should they have let's say a roommate, you need to make sure you communicate with the roommate. They could help for the patient, or else they have to be placed in a private room. But you know the hospital will not just place them in a private room just because of that, right? Next thing that needs to be on your list: student study focus checklist for your new gen starting April 2026 changes is clinical judgment practice. Recognizing cues. They want you to be able to recognize cues. That's what the title is under. So you need to be able to recognize cues, analyze cues, prioritize hypotheses. Okay, okay, basically possibilities, the risk versus complication. Do you know when someone has a risk versus a complication? For instance, if somebody has atrial fibrillation, what are they at risk of? They're at risk for clot, guys. But what would be a complication of that? Stroke. Do you see the difference? So generates clues. Now, the last thing I have here on the list is testing stamina. Test stamina is practice set at a reasonable pace with review and remediation. So you need to continue with your review, with your remediation. Do not stop, and you've got to keep going. Make sure you get to do your practice questions, not just understanding. Especially if you leave school, it's been over a year or over 6 months. Maybe you start forgetting some of those contents. So it's important that you need to do a quick review, get into your review, and then make sure you get trusted professional test questions. And I'm not gonna tell you, you guys know already, there's tons of them out there, but I do have my personal recommendation. And if you were to call me, I would tell you exactly what you need to, what I would recommend for you, test-based questions that you would need, the best ones out there for you to be prepared for your Nclex. Okay, guys, do we have any questions so far? Any questions? Please put your questions in the chat, and every now and then I will be checking them. And now, as I promised you, I go through the do's and don'ts, what's going to be changed and what will not change, and I broke them down into details, right? There's going to be 70 changes and 5 things that will remain the same. And now, let's see some of those questions, okay? I'm going to stop sharing right now so I could go ahead and not this one. Hold on. Let me stop sharing. Okay. And now I'm going to. Okay, perfect. Oh, I'm glad I have some people here. Welcome, welcome. I don't see who is joining me, But please put some questions in the chat. Let me see. Oh, I do have some questions in the chat. Thank you for this information, my friend. Please share the live. Please share the live. Now I'm going to give you guys some Nclex style questions. But before I do that, I have another slide I want to share with you. As a picture, or since you're gonna have this, you can review it here. Anyways, sorry guys. Let me just share this with you. Here we go. This is another page. I hope you could see this. 2026 Nclex foreign changes versus no changes. And this is a snapshot of some short summary of what I just went into details. As you can see, the dark green, the forest green, these are going to be things that will be changed. And the light green or the light blue, these are things that will not be changed. If you want to take a screenshot of it, just so you know, you could do that. Again, what's going to be changed in the new Nclex starting April 1st, 2026, and that will not be April Fool, guys. Don't be fooled. We said terminology updates, time management guidance will be changed, privacy, social media, okay, that we just gone over, will be changed, internal device monitoring will be changed, health equity emphasis will be changed, safe category name will be changed, test plan start date will be changed. But what will not be changed, guys? Questions for areas that will remain the same. Clinical judgment focus, that will be the same. Remember your 4 different tests with your levels, your knowledge. They're going to test your knowledge. They're going to check your understanding. They're going to check your how do you analyze the question and how do you apply your knowledge. These will not be changed. And what will not be changed? The categories of percentage. Remember, managed care is under med-surg. That's over 20%. That will not be changed. Pharmacology, I believe 12%. I don't have it with me. That these percentage will not be changed. What else? The client needs categories. We're talking about med-surg. You're still gonna be testing you on med-surg. You're still gonna test you on peds. You're still gonna test you on pharmacology. You'll still be tested on maternal health, right? OB and pediatrics and pharmacology. And the format for NGN, guys, which is the new Nclex generation, which has been around for 2 years now. Remember, there's 10 types under NGN itself, and I have a book that breaks every style down. We're talking about bow tie. We're talking about matrix, the drag and drop, the what else? Fill in the blank. The case studies. They give you the 3 case studies, and under each study, there's a total of questions, and you build on these questions. So these will not be changed. And last and not least, yeah, that's it. Exam format for the engine will not be changed. So you're still gonna have those studies. So you guys can take a quick picture of that before I move to now and style questions, because you know I always finish with some questions, and I hope you guys can participate with me. And you guys look at now. I'm gonna stop sharing because now we're gonna go through some examples. Okay, let's go. Let's go now. Okay, share screen. Okay, perfect. Now let's go, guys. Let's go. If you have the answers, please put your answers in the chat after each question. Okay. Let's go with the first question. 58. Let me see if you guys all can see. Let me try to enlarge this for you. Hold on. Let me enlarge it right here. I hope you all can see. A 58-year-old patient with history of type 2 diabetes and chronic kidney disease is admitted with cellulitis of the lower leg. The patient intracranial pressure ICP monitor has been placed following a recent fall. During morning rounds, you note the following. Number one, the ICP monitor waveform shows sudden sharp spikes over the past hour. Second thing you notice, the patient blood glucose is 320 milligram per deciliter. Third thing you notice, the patient's daughter requests that no insulin to be given without her approval because of her concern about hypoglycemia. And the last thing you note here, the patient is in isolation for MRSA. Okay, so hold on a second, please. I'm so sorry. Okay, here we go. This is another one. Hold on. Let me stop sharing because I lost. Sorry, guys. Things happen. I switched over to a different solid question. Hold on, please. And thank you for your patience. Perfect. I'm going to reshare it with you. I'm going to reshare it right now. And I am so sorry about that. Perfect. Nope. This is another one. Stop sharing. Oh, please. Okay. That's not the one. Here we go. I found it. Okay, guys. Let me see. Bring this right here so you guys can see. Here we go. And let me enlarge it so you guys can see. Okay. So we're going to start again. We have a study here. We said a 58-year-old patient with history of type 2 diabetes and chronic kidney disease is admitted with cellulitis of the lower leg. The patient intracranial pressure monitor has been placed following a recent fall. During your morning rounds, you know the following. ICP monitor waveform shows sudden sharp spike over the past hour. Number two, you notice the patient blood glucose is 320 milligrams per deciliter. Number three, you notice the patient daughter requests that no insulin to be given without her approval because of her concern about hypoglycemia. And the last thing, the patient is in contact isolation, okay, for MRSA. So now the question they're asking you here, they're already giving you the case study, the scenario. Now, this is the question. Which action should the nurse take first? Okay. Number one, do you administer insulin as prescribed according to the sliding scale? Remember, the blood sugar is 320 milligrams per deciliter. Number two, do you assess the intracranial monitor connection and waveform accuracy? Remember, it was showing what? It was showing sudden sharp spike over the past hour. The ICP monitor waveform. This is one of the new things they're going to be testing you in the new Nclex starting April 2026, April 1st. And then the last thing I have here, okay, hold on a second. Hold on a second. Hold on. Oh, where's my, hold on a second. Oh, see, I lost my thing again. Hold on, stop sharing. And now I'm going to bring this down. I am so sorry. Here we go. Hold on. Okay. Okay. All right. It's giving trouble. Thank you for your patience, guys. Here we go. My thing was gone. Now I see it. I see it now. Perfect. I see it. I don't have my mouse. That's the problem. Here we go. Okay, now I'm going to share with you. I'm going to do that right now. Here we go. And thank you for your patience. Here we go. So what is the answer, guys? The last thing I have here which is D. Do you reinforce hand hygiene? Here we go. About the MRSA. And let me see if you guys can see the answer. Okay. Do you reinforce the hand hygiene and reinforce MRSA isolation precautions that are intact before entering the room? And the answer is B, guys. Assess the ICP monitor connection and waveform accuracy. Now, let's see the rationale. The answer is B. Here's the rationale. Oh, let's go see. Okay. It says here why this answer is best. Safety and infection prevention and control is ongoing, remember, but it's not the first immediate action here. Even though safety and infection is always ongoing, because we have here the patient's blood sugar is up, but their ICP is spiking. The daughter wants her approval before giving insulin, and then the patient is in isolation for MRSA. But what is more critical here? And that's what you want to focus on. Safety and infection. It says here prevention is ongoing. However, it's not the first immediate action. So while the following isolation precaution is essential, the immediate clinical concern here is the irregular ICP waveform. This represents a potential neurological deterioration requiring prompt assessment before other interventions. And that makes sense. So this question wasn't so bad, because when you really looking at the other ones, the other options, which one that's really more critical or more concerning is really the ICP that's spiking the wave. Okay, guys? You guys get it? Okay, now let's move on to the next question here. Okay. I want to make sure you guys can see. So the second thing, before we go to the next question, says the clinical judgment must guide priority identity, the most acute threat to patient stability. So sudden changes in the ICP waveform may indicate increased ICP. So we're still answering why the answer is the right one. So these are the rationales. So the nurse must first verify the accuracy of the data, potential physiological, the reflect clinical judgment, and priority Nclex framework. And why not giving attention to the daughter's concern? It says the daughter's concern and education about insulin, which is C, are important, but come after ensuring patient neurological status and safety. And that makes sense. It says family safety or education is critical, especially involving health equity. Remember, health equity is one of the new concerns that's coming up in the Nclex 2026, April, starting April. So it says here, especially involving health equity and unbiased care, but not at the expense of urgent clinical assessment. Does that make sense? And administering insulin may be indicated later, but the priority now is to interpret the ICP. Well, right, because it's spiking, it's giving irregular signal. So it's not, that is a big concern. Before shifting focus to glycemic control, because especially it says their blood sugar is 320, yes, but then the ICP is more alerting than giving insulin right now. You guys see? So immediate safety concerns precedence over scheduled treatment when instability is suspected. All right. And the last one, which was the MRSA, patient is in MRSA or isolation contact, precautions. It says here, reinforce MRSA precautions, support infection prevention, but does not address the urgent neurological concern first. Okay. So that's the rationale. So now, remember, clinical judgment, prioritization, that's recognized and responding to acute deviations in patient status. So prioritization is always the number one thing you want to look at. And there's always, remember, we look at physiological versus psychological, right? So safety and infection control, understanding precautions but applying them within the entire care picture. Advanced technology monitoring that's recognized device reading and potential malfunctioning. And health equity, which is another one that we mentioned earlier, communication, balancing family concern with critical clinical needs. Okay, so now let's go over the next question I have here for you. Okay, let's go. A 40-year-old Hispanic male with newly diagnosed type 2 diabetes refuses glucose monitoring because of his belief. Illness is God's will. That's what the Hispanic 40-year-old says to the nurse. He rarely checks his feet and avoids medical appointments. What is the nurse's best initial action? Okay. Now, we usually say, I've heard a lot of Hispanic men are stubborn and they don't like to really follow up with medical appointments and treatments. However, we cannot put all Hispanic male in one case because remember, that's stigmatized and also aware of their culture. So we have to be careful. Individualized care. So it says here a 40-year-old Hispanic male with newly diagnosed type 2 diabetes refusing glucose monitoring because of his belief that illness is God's will. He rarely checks his feet and avoids medical appointments. What is the nurse's best initial action? 1. Tell him diabetes complication will be severe if he refuses monitoring. B. Ask about his belief. Listen and incorporate cultural understanding into his care plan. C. Notify the provider that the patient refuses care. And number 4, provide written diabetic foot care instructions only. So this one is another easy question. So what is the answer? What would be your best initial action? Initial means things you would do first. What would you do first? Would you tell him diabetes complication will be severely if you refuse monitoring? Is that threatening him? Is that a good thing? Would you do that? Or would you ask him about his belief, listen to him and incorporate cultural understanding into his care? Yeah, maybe, right? And let's do the third option, notify the provider that the patient refuses standard care. All right, the doctor will be like, so what? What did you do? The doctor is not on site. So is that the best thing for you to do? Or would you just provide written diabetic foot care instructions only? Whenever you see that, you see the only, you know that's definitely that's not the answer because of the word only. So what's the best answer, you guys? Yes, all got it. B, right? Okay, that's the answer. So B, recognizing personal beliefs and practicing health equity and unbiased care ensures culturally sensitive interventions and exploring beliefs builds trust and informs mutually acceptable plans. So remember, the new Nclex starting April 1st, 2026, they're going to make sure that you are culturally competent and you're not stigmatized anybody. Don't put all eggs, or that I don't want to say eggs in one basket. No, don't put all people in one basket. We need still to individualize the care. Does that make sense, guys? Okay. The next category that's going to be tested in April 2026 is infection prevention and isolation compliance. So they don't say infection control anymore because they want to focus on more prevention. So here we go. A patient with active tuberculosis repeatedly removes his mask in the hallway. Which action should the nurse take first? Number 1, we evaluate the patients about TB transmission and importance of masking. Number 2, contact the healthcare provider to order restraints. Lord have mercy. C, place signage about TB outside of the room. So you're gonna put some posters outside of the room. Okay. And the last thing here, would you just allow the patient to walk without mask to prevent agitation? Okay. So this is another easy question. This is under infection prevention. So remember in Nclex, they're not going to give you category. You're just going to have to, based on the question, to figure it out. Here, I tell you the category because I want you to see what they're asking you here. But on the real exam, they're not going to write categories. You need to figure it out because I will be giving you too much hint for you to get the question. So what is the answer, guys? Patient has TB and is repeatedly remove his mask in the hallway. Because remember, I said when you go into the room, you nurses, you wear your N95, which you had previously tested, right? Well fit by personnel care, right? The health department and your facility. You already being fitted, pre-fitted, and who are you protecting? The patient or you're protecting yourself when you're wearing the N95. But if you were to go into a neutropenic patient's room where the WBC is less than 2,000-3,000, you are protecting them. And you don't need N95 mask. You just wear the regular mask, okay? So now here, should the patient leave the room, they are in airborne room, we wear N95 when we go see them. But if they're going out, I say they went for a walk or they're going for a procedure, they do leave the room sometimes, guys, but they need to have what? They need to have their mask. Now, this patient, this scenario says he's constantly removing it. What is your role? What action should you do first? Do you re-educate patient about transmission, the importance of masking? Do you contact the healthcare provider to order restraint? Do you place, say, a sign in front of the door, or do you allow patient to walk? This is another easy question, and I know what you all say. Yes, the answer is A as an apple. The rationale is address the gap of in understanding education is priority. Teach patients. Some of them they don't do better, and remember, education is ongoing. Even though you tell them 5 minutes ago, and then 5 minutes later they do the same thing. You have to reteach them. So priority, especially with airborne illness, immediate safety and infection prevention depends on the client. Remember, these people, guys, these are communicable disease. So even now, when they were to be discharged, go home, before they go home, we as nurses advocate all in. We need to call the health department and let them know because it's a communicable disease. It will affect the community. Even the people in their house must be tested before the patient go back because they probably all are infected in the room, in the house, then they will need to be treated. Remember that it could be 15 to 18 months, sometimes 2 years. So we need to be mindful of all these things. Okay. Now, question number 3, guys. This is another category that you're gonna be tested in April for 2026. Number 4, monitoring technology, clinical judgment. This is another thing that's going to be tested. That's what I said. So a patient with subarachnoid hemorrhage has increased ICP monitor. Over the past hour, the ICP reading are trending upward, and the waveform suddenly changes. Which should the nurse do first? ICP monitoring, what should your nurse do first as it's trending? That means going up and up and up and up, right? So A, do you reposition the patient and assess the vital signs? Do you check the ICP monitor connections and the waveform accuracy? C, do you administer hypertonic saline as ordered? And number 4, do you notify the provider immediately? What do you do? Remember, in ICP, we've already gone over the signs, symptoms, but how do we bring these symptoms down? Okay? What's the answer, guys? You got the answer? The answer is the box. Yes, the answer is B as in boy. Check the ICP monitor connections and waveform accuracy. And what is the rationale for that? It says your technology competency requires first verifying monitor accuracy before interventions, before cause faults could mislead care. And guys, remember, whenever we hear an alarm, it doesn't have to be this ICP alarm. It could be a telemonth alarm or a patient on, let's say, a chest tube or maybe on a ventilator. Before we check the monitor, we always check our patients. What are the signs and symptoms patient are being displayed? So you need to check your patient to see if they're okay first. Then you check the machine, right? Patient before equipment, always. So we check, it says here B, check the ICP monitor connections and waveform accuracy. Okay, we will not reposition the patient and set vital signs because we don't know what's going on. Administer hypertonic saline, that's treating, that's treatment. And then notify the provider immediately. He's gonna ask you, what did you do? Come on, you never call the doctor first. You always try to do something. It's when you cannot do anything at all, that's when you call the doctor, right, guys? Okay, number 5. This is under pharmacological and clinical safety. This is another category that's going to be tested in April 2026. A patient is prescribed warfarin for atrial fibrillation. The INR returns at 5.4. Which action should the nurse take first? You all know INR for normal people. You don't give them, the normal level is what, guys? It's 2 to 3. But if they are on mechanical ventilation, we expect the INR to be higher, 2.5 to 3.5, because they are more at risk for what? Clotting, guys. So a patient is prescribed warfarin for AFib, because remember we said when somebody has atrial fibrillation, not only that risk for blood clots, but complication of that is stroke. So a patient is prescribed warfarin for atrial fibrillation. The INR returns 5.4. Which action should the nurse take first? A, administer vitamin C as prescribed. That means what? The INR is super high. Would you tell me the patient is at risk of clotting? Think about it. Patient is at risk of bleeding, guys, right? Okay, because they are what? They're on INR. On so administer vitamin C prescribed, which is an antidote of warfarin. B, hold the next dose of warfarin. C, assess the patient for bleeding. And number 4, notify the healthcare provider. Again, we don't call the doctor first. That's never our priority first. Or documentation. That's never a priority. So patient INR is 5.4, right? That's a test result. And this test result is what? Is not just a regular test result. It's critical. What are you going to do about it? First, you're going to assess your patient. After you finish assessing your patient, there's nothing you can do. You got to call the doctor, right? So do you administer vitamin K? Do you hold the next dose? There's something you can do before you call the doctor. Do you hold the next dose of warfarin? Or do you assess patient for bleeding? Or do you notify? This is another question. Come on, guys. Come on, guys. Give it to me. What is the answer? A, B, C, or D? Put it in the chat. Put it in the chat. And if you say C, you are correct. Because we have to assess our patient. That is the first thing we do before we call the doctor. Assess the patient for bleeding. Because that's super high. We already established the normal INR is 3. If they are on mechanical ventilation or immobile, we expect it to be higher, 2.5 to 3.5. You have a 5.4, that means patient can be bled out. So we need to check a patient bleeding. And then what would after assessing patients for bleeding? Let me see if you guys can tell me. Would you administer vitamin K? Do you have that as a standing order of PRN? Or do you hold the next dose of morphine? Or do you call the doctor? What would you do next after you assess for bleeding? Let me see. I would hold the next dose of morphine, guys, before I administer vitamin K, because I don't know whether that patient has that PRN order. I would have to call the doctor to get that. Do you know what I mean? So before modifying treatment, the nurse must assess acute bleeding risk, a key clinical judgment step to determine urgency and interventions. Okay? Yes. Assess the patient for bleeding, then hold the next dose of morphine, then call the doctor, and after, maybe he will prescribe vitamin K as prescribed, which is an antidote of what? Antidote of morphine. Perfect. You guys see where I'm going with this? You guys get it? So these are the categories that's coming up your way. 2026, April 1st, 2022. And we said that will not be so full. They are real. Okay. Now, sixth question. Priority and client needs. This is another category that's going to be tested in April, starting April 1st, 2026. Get ready for this one. How do you prioritize your patient needs? Which of the following clients should the nurse assess first? Okay. A client with postoperative fever, 38.3, mild incision redness. Okay. You already know this is over 100, right? Degrees Fahrenheit. Number 2, a client with Alzheimer's disease, wandering the hallway unsupervised. C, a symptomatic client. Let me see if I can read that. Let me see. I cannot read that, but I don't want you to see my answer. Okay, there you go. A client with Alzheimer's disease. We said B, a client with Alzheimer's disease, wandering the hallway supervised. C, an asymptomatic client with a new central line placement. That's a perfect patient, right? And then you have a client receiving scheduled anti-hypertensive medication. So which one that should be your priority? This is another easy question, guys. Should it be the one with fever over 100? Should it be the client wandering the hallway unsupervised and she has Alzheimer's? Does she have a leg tracker, right? You need to check all of that. Would it be someone who's asymptomatic but has a new central line? It already tells you guys, this is a giveaway. This is a patient that has no symptoms. And then the last thing, a client receiving scheduled antihypertensive. So what? Okay. So the answer already, this is another easy question. Yes, you all know the answer is B, as a mole. So why not A? Somebody may be thinking A. Why not A? Patient has a postoperative fever, 38.3, and a mild infusion redness. Does that show signs of infection? Yes, but it doesn't tell you the hours postoperative. And I'm thinking, remember the first 24 hours, guys, if somebody has an infection, it doesn't mean that they have an infection. It's due to the hemodynamics, the all manipulation of the blood, the body, the surgical procedure. That's due to hemodynamics. That doesn't necessarily mean they have an infection. But after the first 24 hours, if they're spiking, if they have an infection, you know this is related to infection. Now, 38.3 degrees Celsius is how many degrees Fahrenheit? To Fahrenheit. Let me see here. It's 104. That's not even 101, guys. It's almost 101. Okay. But it's just with postoperative fever. Okay. The thing is, I wish they tell us exactly how many hours post-op because it matters. Remember, Climate, Mark K tells us the first 12 hours is very critical. Patient patient is very unstable the first 12 hours, but after the first 12 hours, it's more like stable. So that's why the answer is B, guys. The client wondering unsupervised placement and immediate safety risk to self and others, a priority over routine assessment. Do you see why 100.94, almost 101, is not priority? The client with Alzheimer's disease is more priority because there's more safety. You understand? I hope you guys got this correctly. Okay, number 7. Let's move on. Almost done. Now, infection against prevention. Which intervention most effectively breaks the chain of infection at the portal of entry? Basic care comfort, guys. Infection prevention. A. Practicing proper hand hygiene before patient contact. B. Cleaning and dressing wounds aseptically. Okay. And C. Isolate an infected patient. And D. Administering antibiotics as ordered. What's the answer, guys? What is your priority? Which intervention most effectively breaks the chain of infection at the portal of entry? Would it be practicing proper hand washing before each patient care, cleaning patient dressing acceptably, or isolating infectious patient, or administering antibiotic disorder? You all know that answer. This is basic care comfort, guys. The best way is cleaning. It says here the answer is B, cleaning and dressing wound aseptically. Why is the answer over A? Here's the rationale. Aseptic wound dressing directly prevents pathogens from entering, crucial infection prevention strategies. So practicing proper hand hygiene before patient contact. Remember, we will wash our hands before each patient. We hand sanitize before entering each patient and before receiving. However, if patient is on isolation or patient has contact or isolation, or let's say you're performing a wound, we would wash your hands before and after. So that's why the answer here is cleaning and dressing wound aseptically. That directly prevents pathogens from entering. Okay, so I hope you all got the answer correct. Okay, next question. Next question here. Let me see, where's my type of D? I need to see all that. Okay. Now, this is clinical judgment and delegation. A new RN assigns a client to a nursing assistant. The client needs vital signs every 4 hours and oral hygiene. Which task should the nurse perform directly? A. Would you instruct the NA to obtain the vital signs? Would you delegate both vital signs and oral care to the CNA or the tech or the nursing assistant? C. Would you perform the first vital signs and oral care assessment yourself? Or would you only delegate oral care to the NA? A new RN assigns the client to a nursing assistant. The client needs vital signs every 4 hours and oral hygiene. Which task should the nurse perform directly? So, which task should the nurse perform directly? Would she instruct this nursing assistant to obtain vital signs? Would she delegate oral care and vital signs to the nursing assistant? Would she perform the first vitals and oral care assessment herself? Or would she delegate oral care to the CNA? What's the answer, guys? This is basic care comfort, guys. The answer is C, as in cat. So perform the first vital signs and oral care yourself. You want to establish the baseline, guys. A lot of people, I remember the hospital, they actually was taking away the post-patient vital signs from the text to the nurse themselves, because we found out a lot of patients end up going to ICU or critical care because the texts were not taking vitals properly, and patients end up with complications. So that's why it's important. Your first vitals, you want to get them yourself. That's priority. That's safety. Establish the baseline. Then maybe the next one you can delegate to nursing assistant, especially if it's a new nursing assistant. Okay. So you want to make sure you get the first vital signs. That's safety. Okay. And this is the rationale here. It says here, RN must directly perform the initial assessment to recognize and analyze cues before delegation. Oh, I like that rationale. So remember, the first one is the first set of vitals is you. It falls on you guys. That's Nclex. I know in the real world it's different, but Nclex wants you to do it like that. Now, we're going under psychosocial and health emotion. Remember, all the subjects going to be tested. They're not going to leave your method, your P's, your psych, everything going to be tested, including pharmacology. A 55-year-old client with late-stage failure refuses to discuss advanced directives, stating, I'm fine. What is the best nursing action? Excuse me? Okay. A 55-year-old client with late stage of heart failure refused to discuss advanced directives, stating, I'm fine. What is the best nursing action? A, do you explain the legal importance of advanced directives? B, do you ask open-ended questions to explore the client's concerns about planning? C, do you tell the family the need to decide for him? No way. Or do you document the client's refusal without further discussion? You always tell the documentation is always the last thing. So between A and B, guys, what's the answer? Do you explain the legal importance of advanced directives, or do you ask open-ended questions to explore clients' concerns for planning? The answer is B, guys. Ask open-ended questions. If they were to say close-ended questions, that would not be the answer, because all you give patients to answer yes or no. But open-ended, give them more ways to explain themselves, and so you'll learn more about them. So the rationale here says using therapeutic communication to uncover barriers and perception supports patient autonomy and unbiased. Remember, this is going to be one of the new categories that's coming up in Nclex, or in the new 2026 Nclex starting April 1st. Okay? Let's see if I can get some water, please. Just clean my throat. Thank you so much. Thank you. I'm gonna drink some water here. Okay? Do you guys see? So correct answer is B. Using therapeutic communication to uncover barriers in perception supports patient autonomy and unbiased care. And now question number 10. Question number 10. Okay. Let's see. 10. What is 10? I'm looking for option D, because there always is option D. Let's see option D. Okay, there you go. A nurse notes the following lab values for a septic patient. WBC is 22,000. Lactate 4.8 millimoles per liters. And you have MAP, right? 64, right? And then you have which action should the nurse take first? Remember, when you're checking the blood pressure, there's always a MAP. That's the mean arterial pressure. What is it supposed to be? It's 64 right here. What is the normal MAP? Normal MAP. What's the range? Mean arterial pressure for syringe, 70 to 100. We want it to be not below 70. And here it's 64. So the nurse notes patient WBC is 22,000. What is the normal WBC should be? Remember, 5 to 10,000, guys. Lactate. As checking your lactic acid. We always want it to be below 4, right? That's one of the tests that needs to be tested when someone comes with septic. Before they see the septic chart, they check what? The lactic acid. If it's 2, they have to be tested again. It has to be retested 2 above. And if it's 4 above, we know patient has lactic acid. That's one of the signs septic shock, right? And it has to be transferred on ice. Remember to put it in that clear bottle, plastic, and it's sent to the lab. So the nurse notes patient, there you go, patient has to be septic. I forgot that. Patient is septic. So when patient comes with sepsis, guys, they check the urine analysis, they check the lactic acid, they check the WBC, right? All right? And what else? Vital signs, definitely. Okay? So now, remember, this is one of the critical one of the critical patient you have. If they have septic shock, you cannot afford to leave that patient, okay? Because patient can deteriorate anytime. So they're testing all of them. Which action should the nurse do first? Do you bolus IV fluids with protocol? Do you notify the physician immediately? Do you recheck blood pressure manually? Or do you prepare to administer antibiotics? Remember, once determined, we have the results already. So patient is septic. So when patient is septic, we have a lot of things we have to do. We got to push fluids. We got to give antibiotics. Of course, they don't have the result because they also draw your blood cultures. I forgot to tell you this. Besides the urine analysis, they also draw blood cultures. And you know, cultures, they come within 40 to 72 hours. However, they will not wait to get the results of the cultures. So they will start patient on broad spectrum antibiotics. What are the broad spectrum antibiotics has? Your sulfonylurea, your penicillin, right? Your psyllin. So these are the broad spectrum your patient would be started. So obviously patient is septic. Patient's going to septic shock. So what is the priority? Is it to hydrate patient? Is it to administer antibiotics? Is it to give him some kind of antipyretic? Okay. Is it bolus IV for protocol? Number 2, notify the physician immediately. Number 3, we check the blood pressure. Sometimes the blood pressure can be elevated. And also to administer antibiotics. What's the answer, guys? And you never want to leave that patient. Don't leave that patient. Never. If you have an emergency, you have somebody else screaming on next room or something, you call for help. You cannot leave the patient. The answer is C. We check the blood pressure manually. Excuse me. Why? It says before action, confirm abnormal values, higher reliability, crucial clinical judgment step. Okay? That blood pressure, we check, we assess. That's what you're gonna do. So some takeaways, but of course, definitely once you recheck, you go into bolus that patient, hydration, 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 hydration. Because remember, guys, during septic shock, the body is smart. It only focuses on the priority, which is your major organ, your brain, because your brain is a major organ, heart is a major organ, your lungs are major organs, your kidneys are major organs. So the body is focused on the core. Forget about your knees, forget about your hands, forget about your legs. That's not your priority. And remember, the blood will take the circulatory system usually will take longer to go down there anyway. So during septic shock, it's like the body is trying to survive. So, of course, hydration is the key. And along with that, there was the broad spectrum, right? So hydration, bolus patient. Okay. So key takeaways for 26 Nclex success, guys. The 2026 Nclex focus on clinical judgment, recognizing cues, analyze data, prioritizing hypothesis, implement safe interventions, evaluating outcomes, not just factor qual. Infection control now emphasize on prevention. They don't do infection control, they don't control it anymore. They want to prevent it. You see, that's the new rule now. Prevent infection, such as the septic technique, isolation. What else? Your sterile procedures, appropriateness, patient education. That's what they're focusing on. Teach patients, family members before they go into a neutropenic patient home. A lot of times, these patients are like, "Well, that's my family. I can walk in there without protecting themselves or protecting the patient." They don't think they are protecting patients. We need to know that they are patient has to be protected. That's why we limit the visitors. They can't come, okay? And they need to be educated. Why? Because they get mad. All right. Now you're a bad nurse. So educate patient why they cannot come to the room as often. Health equity and unbiased care are explicit tested in patient assessment and communication. And lastly, we have your modern care competencies include monitoring technologies and critical data interpretation. Any questions? I have 10 more questions to share with you guys, but let me see. Let me stop sharing to see if I have any questions in the queue before I continue, because I share a lot with you this afternoon. I share quite a bit. Let me see. Come on. Is there any questions here, guys? Do you guys have any questions? I know you will be reviewing these things again. You have to check them again, and just to make sure you know those changes coming your way. Even right now, if you're going to take that test before April, you want to know the things that will not change. However, you will need to know the future that's coming up if you plan on going in April, right? Okay, so now I have another set of 10 questions. I always believe after you understand the material, doing questions is the key thing to remember your material. If you're just reading, and not doing questions, I'm sorry for you. You may not, you need to test yourself to really retain those information. And test questions, doing questions, that's how you testing yourself, your see how much you. And when you are doing questions, remember you need to focus on not just the rationales, the ones you get right, but especially the ones that you also get wrong. You need to know because it's a learning experience. Okay, so now I'm going to share with you the last 10 questions on category, this category right here. Okay, let's go. Here we go. Okay, I hope you guys can see. All right, septic technique. Again, basic care comfort. We no longer call it infection control, we call it infection prevention. Let me see if you can get those answers, guys. During a wound dressing change, the nurse accidentally touches a sterile glove to the patient's bed frame. What should the nurse do next? A, continue with the procedure, only change the gloves if visibly contaminated. B, Replace the glove and continue the procedure. C. Proceed and cover the field with sterile towels. And D. Stop the procedure and notify the physician. What would you do? During a wound dressing, the nurse accidentally touched a sterile glove to the patient's bedframe. What should the nurse do next? Do you continue with the procedure? Only change the glove if visibly contaminated? Do you replace the glove and continue the procedure? Do you proceed and cover the field with sterile towels, or do you stop the procedure and notify the doctor? Hmm? The answer, guys. Let's go. Yes, the answer is D. Replace the gloves and continue the procedure in sterile technique. As you can see, this is probably a sterile wound care. That's what it is. So it's a sterile wound dressing. So it says here, in sterile technique with questions, recognize contamination immediately and correct before proceeding. That's what we have to do. We cannot afford for our patient to be infected. So we have to be on top of our game. Okay? Hold on a second. Ooh. Let me see. I'm coming back. I hope you guys can see this. Okay? Okay, here we go. Number two. So strategies. Can you guys see my screen? Can you guys see my screen? Can you check to see if you see my screen currently, please? YouTube channel. I just want to make sure they can see. Let me see. Because I stopped sharing and I just want to make sure they can see at the side. If they can see. Currently, can they? Are they able to see it? Okay, perfect. Currently, can they? Okay, so keep checking for me, please. Correct. It says replace the gloves and continue. They can? Okay. So replace the gloves and continue the procedure. So what is the rationale for that? It's the strategy and sterile technique questions. Recognize the contamination immediately and correct before proceeding. The rationale is touching the sterile gloves to a non-sterile surface contaminates it. And the nurse must replace the gloves, must maintain asepsis. Continue with contaminated equipment increases the risk and infection. And physician notification isn't required unless you have complication. You guys know that. We're not going to call any doctors for this. No. Okay. Now, number two. Which client should the nurse see first after receiving shift report? Would you see a postoperative client with a temperature of 38.8, which is 101.8 degrees Fahrenheit, a slight redness at the incision? Would you see a client with chronic obstructive pulmonary disease, a COPD, who needs an intensive? Would you see a client who's newly let me see, write this down because I cannot see what this says. Okay. Would you see a client who's newly placed urinary catheter and the patient has dark bowel smelling urine? Or would you see first a client recovering from seizure who's alert oriented? What is your priority? Which patient would you see first? The one with fever 101.8 and she had slight redness at the incision? Again, it doesn't tell you how many hours post-op. Remember, we said 12 hours post-op. The first 12 hours are very unstable, very critical. After 12 hours, patient are more stable. And we also said the first 24 hours, the patient has a fever. It's not because they have an infection per se, but it's due to what? The hemodynamics of the procedure, right? All these manipulation, the blood, all these things. After the 24 hours, then if they spike, they have fever 48 hours, then you know it's really infection, right? Or would you see a client with COPD who needs incentive thermometer? Is that a concern? No. Client newly place urinary catheter and she has dark, foul smelling urine. Is that a concern? You hear the key word. Pay attention to keywords. What's the answer, guys? Yes, C is the right answer. Even though they don't tell you how many hours post-op. They don't say whether the patient has 2 hours post or 10 hours post or 11 hours post. But you know, when you are prioritizing, C is a client with a newly placed. That means that's a new, fresh, the keyword, newly placed urinary catheter. And patient has what? Dark, foul urine smell. What's the rationale? The rationale is ABC. Client with a newly placed urinary catheter, which has dark urine, foul smelling urine. The strategies ABC safety infection prevention priority. Think about potential infection complications. The rationale here is dark, foul smelling urine catheter placement can indicate urinary tract infection. Needs immediate assessment and intervention. Post-op redness could be early infection signs, but less acute. And then census thermometer, guys, we know it's a priority because it says patient is stable, okay? And that's why a patient can wait. Any time patient can wait, it's not a priority. You guys see what I mean? So that's why even patient has a fever of 101.8. But the patient with catheter, with newly catheter with foul dark is priority over that. You guys see that? Even though they're both concerning. Next. A client with C. diff infection asks why they must wash their hands with soap and water. Okay? Why they must wash their hands with soap and water instead of alcohol hand rub? What is the nurse best response? A. Alcohol rub are too harsh and dry out the skin. Is that what you tell your patient who has skin and they're asking you whether they should wash their hands or not? Or do you tell them soap and water are better for routine hygiene? Or do you tell them alcohol doesn't kill C. diff, spores, soap and water does? Or do you tell them hand washing is a doctor's order? What is the best answer here? This is a very easy question, guys. Put the answer in the queue. Let's go. This is again our test strategies, not just coming up for Nclex 2026, but also currently. What is it, guys? What is it? The answer, is it A, B, C, or D? You are right. If you C, that's the answer. Alcohol doesn't kill C, difficile. Soap and water does. That is so right. Focus on mechanism of infection prevention in patient teaching question. The rationale is alcohol-based sanitized is not reliable or to kill C. diff. You guys know that. They're not reliable. Physical removal with soap and water is necessary. Again, when we entering someone who's in a contact isolation, we have to wash our hands before and after. Okay, then we hand sanitize. Okay, very important, guys. Just like your hands are visibly soiled, you treat them. Okay, next question. Make sure I got 4 answers. I see 3. Here we go. Clinical decisions. Which action breaks sterile technique? During a sterile dressing change, A, opening a sterile package away from the body. B, dropping sterile instruments onto the field from 6 and above. C, donning sterile gloves without touching the outside. Or D, place sterile drinks before cleaning the area. What is the answer, guys? Which action breaks sterile technique here? You're going to tell me, and this is under infection prevention slash basic care, because this all these steps you guys learn in foundation of nursing. I teach nursing 101, the lab. We teach sterile insertion, sterile procedures like Foley catheter insertion, sterile wound care. Okay, so these are basic care comfort. You cannot afford to miss those. Okay, so which answer here that shows that the nurse is breaking the sterile technique? Is it A, opening sterile package away from the body? Or is it B, dropping the sterile instrument onto the field from 6 in above? Is it C, wearing sterile gloves without touching the outside, or place soldiers before cleaning the area? Which one is it, guys? The answer is B, dropping sterile instruments onto the field from 6 in above. That's what shows she breaks the sterile field. The rationale here, dropping sterile instruments onto the field from 6 inches and above. That's the answer. It says recognize common sterile field violations. Gravity and distance matter. Okay. Dropping instruments from above opens the field up into air. So it's like into air. That's why it's too high up. Contamination, airborne contamination. Items must be placed in a way that prevent contamination. Other options are appropriate. So that's the answer. Number 5, clinical judgment, isolation, patient support. A patient in isolation for a communicable disease, like a TB, which is a communicable disease, okay, is anxious and refuses to wear the required mask. What is the nurse's best initial response? A, restrict visitors to prevent spread. B, sedate patient to reduce anxiety. No way. C, explain the purpose of the mask and infection risk. Right? And allow the patient to remove the mask if not feeling well. What is the best answer here, guys? That shows patient support is C, explain. That's educating the purpose of the mask and infection risk. So when you are doing that, you're educating a patient, because if they don't know better, they will not do better. And you are calling the shots. You are the educator. You are the advocate. Remember, we said inside this circle and for interdisciplinary team, which is all outside of that circle, it's you and the patient inside the circle. So remember, you are the patient, you protecting them, you educating them, you may try to rationalize them, okay? So unless if it's what is it? Schizophrenic patient now, you always want to present reality to them. And your Alzheimer's patient or your demented patient, you always want to distract them. Don't try to present reality to them. But education nonetheless is for everybody. Do you guys see the difference? Education, and it's ongoing. We never stop educating our patient. Okay? All right. So educating, that's the rationale. Educating the patient promotes understanding and compliance. The more apt to adhere to your plan, not comply, because complying is like you're putting pressure on them. They will adhere to the plan because that's what they want to do and that's what's right for them. So visitors can still follow precautions. Sedation is appropriate. Remove mask increases transmission risk. Next question. That's safety equipment. Okay. Let's go. Let's go. Okay. Hold on. Just want to make sure you see my answer. Okay, perfect. Okay, before suctioning a tracheostomy, which action ensures client safety? Now you're preparing for straight suction. Remember, in the straight suction, there's two things. When you suction, there's steps to follow. Before you suction, what do? You hyper ventilate your patient. You have to check the pulse ox, and then you suction as you proceed. And you never want to overly suction them, because the more you suction, the more secretion is gonna come. But when you are changing or cleaning the trachea, it's a different procedure. Now, before you suction tracheostomy, which action ensures client safety? Number one, don sterile gloves only. Number two, check suction pressure and equipment. Make sure they're well functioning. C, hyperoxygenate patient, right? 100 oxygen per minute. And suction continuously while advancing the suction. What's the right answer, guys? The answer is B. Check suction pressure and equipment functioning. You always want to do that first, because what is the big deal if you start suctioning and the machine is not even working? Did you check if it's plugged? Did you test it? So you want to make sure your equipment are well working. Okay, so the answer is B. It says check suction pressure and equipment functioning before you hyperoxygenate 100% oxygen for 1 minute, because you know after you do that you're gonna suction, but you need to check your equipment first before you put on your sterile gloves. Only that's not the answer. Okay, and suction continuously while advanced catheter. That's in after you start suctioning, right? Okay, now let's go with the seven, number seven. Which intervention breaks the chain of infection at the mode of transmission stage? Remember, there's different type of stage. Transmission stage. Which intervention breaks the chain of infection at the mode of transmission stage? A, maintaining sterile field for procedures. B, administering prescribed antibiotics. C, place patients in proper isolation precautions. D, educating visitors not to touch the patient. Is that the right thing to do? Which intervention breaks the chain of infection at the mode of transmission stage? The answer is C, placing clients in proper isolation precautions. Okay. Strategies: identify the length of infection, change the intervention targets. The rationale is isolation interrupts the movement of infectious agents between hosts. Maintaining sterile focuses in the chains. Antibiotics reduces host susceptibility. And visitors education supports precautions, but does not directly interrupt transmission as strongly as isolated. Okay, guys? Next one. We're almost done. Two more questions. Of the following clients do the nurse assess first? Infection risk. A, which one you going to see first? Would you see a 70-year-old with a healed surgical wound? Which one you need to prioritize? Would you see a 45-year-old with diabetes and skin breakdown? Would you see a 25-year-old with common cold? Or would you see a 60-year-old receiving antihypertensive medication? What's the answer? This one is very easy. The answer is B. Diabetes and skin breakdown is more priority over your surgical wound, over common cold, over scheduled hypertension. That's very, very common sense. Next one. A client asks why they must cover their mouth when coughing, even though they have no fever. These days, you see that people are coughing, they refuse to wear their mask. You have to ask them, but they should be able to do that themselves. So then now they're asking the nurse why they need to cover their mouth when coughing, even though they have no fever. The nurse should reply: A, to prevent others from getting infected. B, you don't look sick. C, nurse requires ear. It's here. D, it's only to keep nurse safe. You know that's not the answer. The answer, guys, is A, to prevent others from getting infected, period. They need to be educated. That's the answer. Okay? So, Again, strategies, techniques for 2026 Nclex is over, guys. At the end, this was the last question I want to share with you. Again, remember understanding the clinical judgment, measuring model. Always think safety first. Safety and infection prevention are central to the new plan. But in doubt, pick the option that keeps the client and others safe. Thirdly, master standard and transmission-based precautions. Know when to use contact or the donning, the doffing, what PPEs for droplet, what PPEs for airborne, what PPEs for contact. Okay, this is high yield infection pathway. And use systematic approach to sterile technique. Remember, rule out sepsis. Don't breathe over sterile fields. Replace contaminated gloves. And patient education, many infection control questions, including patient teaching, clear explanation are often the correct answers. And that's it, guys. That's all, folks. Any questions for me? Any questions for me? Please let me know. Please let me know. And we are done. Do we have any questions? Do we have, thank you. It looks like we have more joining us. Welcome, 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 guys. We basically were reviewing today all the updates has come in on the Nclex starting April 1st, 2026. All the changes versus the ones that's going to remain the same. So if you just came, I'm sorry, you can just review the video and you can see all the changes. And we've gone over 20 Nclex style, just some examples so you guys be familiar. So everything that I mentioned, we have a questions, an example. So you can go and we watch those questions and see and understand. Because as I said, when you are paying for Nclex, it's not just reading or learning the material, but it's also important to test yourself to do as many questions as possible. And you will not know what you know unless you test yourself. And when you do a question, you need to read both rationales. The one you got right versus the one you got wrong. So all the rationales, you need to understand. So it's very important. And if you don't know what type of questions, what is you don't know which one to order. I'm not gonna tell you the ones that you need to purchase here. But if you call me, I would tell you the most reliable, the most reputable, the ones that are proven true and true. And surely you will be able to pass for Nclex. So Nclex is a very, very important and serious preparation. So you want to make sure you're ready, and when you go strong and you pass. But if you're not fully prepared, you will miss your chance of passing. So my number, again, I'm gonna put it right here in the chat. It's 201-889-8103. So call me with questions, and I'm going to see if I could prepare some kind of material just to be ready for you so you could be more prepared. And if you need review, please do not hesitate to call me. I can help you on your journey so you can be better prepared. Again, my name is Mrs. Sion. I am a nurse educator. I've been a nurse since 1998. I'm currently teaching at colleges, universities, and also I am passionate about teaching and preparing students for Nclex. So just so you know, reach out to me and I can help you. Again, if you go on Amazon, you're looking for books, and this is the blueprint for Nclex. Okay? Now, just so you know, There's gonna be some changes coming up, and this is what we just gone over, so you could be ready. And also MGN, I also look for that, all the 10 types of the MGN if you need to review that will also be available to you on Amazon. So just so you know, we have everything. Okay, guys, any questions? If you don't have any more questions, let's have a word of prayer and we'll see you next week. Or I think on Sunday. I'm coming back live on Sunday. Okay. Father God, thank you once again for being with us on this platform. It's been over an hour. And thank you for making it possible. I would like to a special prayer on behalf of those who are preparing for the Nclex. Those of them who are struggling, it's more than one time. They have tried more than once, second time, and they still don't get it. They cannot still put the puzzles together. They're struggling. Or some of them are in nursing school, and it seems to be challenging, very stressful. And we ask Father to please give them intelligence, give them wisdom, and Holy Spirit to enlighten their mind, increase their memory, and help them to be able to understand and be prepared, and also lessen their anxiety and know what to do. So on the day of the exam, they will be successful. Forgive our sins, heal us, pray. In Jesus' name we pray. Amen. Okay, guys, you have a wonderful day. God bless. Wonderful evening. Okay, bye now. Any questions? No, I don't have any questions. Bye. Thank you.